Hi guys, so today I want to answer a question that I got online, and the question is, you've been recommended all-on-4 treatment for dental implant treatment to replace all of your teeth, but what are your options, and is that the only way forward? So all-on-4 treatment actually is is more of like a top-end treatment. So it's a situation where you have all of your teeth removed because they're all really bad. You have dental implants placed, and then you have bridges, fixed bridges, placed on top of these implants. And normally this is done all in one day. So it's quite a lot of stuff to do in one day. But it's not the only option, okay? So there are a couple of other options which I give my patients, and I'll go through them now, including all the costs and what's involved in terms of time and all of that. Right, so the most important thing when you're trying to decide on what options are right for you is what is important to you. And for everyone, this is slightly different, but let me give you a couple of answers that I hear all the time. Some people want fixed teeth, which are just not removable at all. Okay, and there's a whole variety of reasons for this. Some people think that it makes them feel old, and other people are completely okay with it. So it really depends on where you fit on there. The aesthetics of the final result, okay, is that really important to you? If it is, I'll show you that whichever implant option you go for isn't really that important. And some people may say, you want to just be able to eat properly, chew the kind of foods that you haven't been able to chew, for example, biting into an apple and things like that. So some solutions will let you do that, other solutions won't let you do that. So again, we need to find out what is important to you. And there's a massive variation in cost as well. So it's important that we find the one which is the right within the right budget, or at least find a way that you can easily afford the solution being offered. So one assumption that I have to make right now is that there are no remaining teeth left, or at least no teeth remaining that are worth saving. So we're talking about either no teeth at the top or no teeth at the bottom, or possibly top and bottom. So our first option is removable dentures, and I think a lot of people will be familiar with this, and a lot of people think that they are rubbish. And the truth is, they aren't always rubbish. I've got plenty of patients who have these dentures and they get on really, really well with them. So it depends on the quality of the denture. If it fits really well, then especially the top one can stay in by itself in a lot of situations. Now, granted, not every situation, not everyone is going to be suitable for a good set of dentures, but it is always an option. It's always the most cost-effective option as well. So the next sort of jump up from this is to consider something called a mini implant, which is exactly what it sounds like. It's an implant, just smaller, and they are actually quite cost effective as well. So they're nowhere near as expensive as a normal implant, and you can get away with like a minimum of maybe 2 of these implants. But what you do is you adjust your own denture to fit the mini implants. So as I said, they are very cost effective, and your own denture can be adjusted. If the fit is good enough, it can be adjusted to fit into these mini implants. So essentially, you're taking your denture and clicking it into something which is going to stop it from moving around, or at least dramatically reduce the amount it's going to move around. And these are quite cool because they can be used in situations where there is very little bone left. Because they are mini, you don't need so much bone to get good stability on these kind of implants. So the next jump up is we're going to use a full size or a standard sized dental implant, and we're going to connect all of them together using a bar. So in this photo, what you can see is at the bottom, that big metal thing is a bar connecting 4 implants together. And then the denture is specially modified to click into this bar. So whereas on the mini implants, if we just jump back a little bit, the denture or the teeth are being held in position by the mini implants and the gum. And because we're relying on the gum as well as the mini implants, the denture itself remains quite big and bulky, so it'll cover the roof of your mouth, maybe a bit less than if you didn't have mini implants, but you still need a bit of coverage there. Whereas with the bar, if we go back to there, you'll be able to see that the whole biting force of the teeth and the denture is being supported by the metal bar itself. So the denture itself can be made much thinner. It's like a little horseshoe shape rather than a full palatal coverage denture. So a lot of people like that because they can taste more food, they get the more texture of the food by having less covering the roof of their mouth, and it also helps people with very bad gag reflexes as well. So the advantages of the bar is it is still removable, and as a clinician, as a dentist, this is an advantage to me because it's so much more easy for you to clean the implants if the teeth are removable. It's a lot more stable than the mini implants, so there's little or no rocking when you're eating any kind of food, and you can eat apples with this kind of solution. So it's used with standard implants. So the advantage is there's a lot more research. A standard implant is stronger than a mini implant. However, you do need more bone with a standard implant in. And like I said, because it's removable, it's a lot easier to keep your dental implants clean. Dental implants fail for one reason, and that's because the bacteria which caused gum disease on your teeth cause gum disease on your implants. And as you lose gum and you lose bone around the implants, they become loose. So if you can keep them clean, it's going to increase their lifespan as well. And then the kind of the almost the ultimate option is a fixed bridge. And here in this photo, I think there's like 8 implants or something like that, or 6 or 7 or something like that. And this whole set of teeth is screwed into the dental implants themselves. So it's a really neat solution, and the reason that people absolutely love this is that you cannot remove the teeth, right? So once it's screwed in, there's no sort of, all the holes are patched up and it's all nice and smooth, and it's like having your own teeth back, okay? And there's no kind of feeling of being old with removable teeth or anything like that. This is as close as we're going to get to having your natural teeth. Because there's no like metal, there is a metal bar, but there's no connections to the metal bar inside it. This is actually a thinner solution than the metal bar solution. So out of all of the options available, this is the thinnest. And on the downside, it is definitely the most expensive of all the options. And I'll kind of touch on the cost, but wherever you go, the costs are going to be slightly different, and nobody really knows the cost until you have a full assessment and make sure that there's enough bone for your implants and things like that. So when you read on the internet about teeth in a day or all on 4, it's usually referring to this kind of treatment, and the whole all on 4 concept is you have the implants placed and then you have a bridge, something like this, not quite the same as this, but you have a bridge fitted on that same day, so you leave with fixed teeth. They are always temporary fixed teeth, so they do need to be upgraded later on. And that causes its own kind of issues, but I'll make another video explaining the all-on-4 process and personally why I don't like it and the other way of doing it, which I feel there's so much more control. So I've not really spoken about the aesthetic side of things. The reason for this is that aesthetics should be a given. With any of these solutions, you should have excellent aesthetics. So the thing is, whichever option feels right to you, whichever option you end up going for, the aesthetics shouldn't be the compromise. You can get outstanding aesthetics with removable dentures, with dentures on mini implants or dentures on bars. This is all possible, so the aesthetics shouldn't be the driving factor. With the whole all-in-4 concept, the reason it's so popular is that, one, it's really sold well by dentists. It is quite profitable for dentists as well, but I think what patients really like is the fact that you don't have to go through a period with temporary dentures, and this is a massive sort of selling factor. And I've spoken to so many patients over the years who said, you know, I really like the idea of doing it staged or whatever. You've got more control if you just remove the teeth, have a removable denture and all of that, but that period of having a removable denture is just out of the question for some people. So it really comes back to where we started on why do you want to have implants? What is it about your current situation that you absolutely hate? Is the fact that a removable solution is going to be will a removable solution be acceptable or not? Is a fixed solution the only solution which is acceptable, or do you just need something to hold that denture in a little bit more tight so that when you're eating it's not moving around, so that you can chew harder foods? So when you answer these kind of questions, then the right kind of solution kind of makes itself apparent. And remember, if we're going to use full-size implants, then we need to have the bone available for the full-size implants. And sometimes this might involve, complicate things like bone grafting or sinus augmentation, sinus lifts and things like that. So these are all kind of things to bear in mind, and until you've had a full assessment, you don't really know which is the best for you. You can do like loads of research, and I hope that this video has been useful. But there's so many kind of variations available. Let's come to cost, because cost is going to be a massive difference. There's a big difference between the fixed solutions and the removable solutions. So if we're looking at removable dentures, in the UK, you can pay up to £2,500 per arch, per set of teeth for removable dentures. Then if you want to upgrade to mini implants, then you can add a few £1,000s for that. When you're looking at the kind of the bar options with full-size implants, then you're looking about £10,000–12,000, something like that. So you can see these things are getting quite expensive now, and when we upgrade further to a fixed solution, you can probably add about £5,000 per set of teeth for a fixed solution over a removable solution. So it's important that you know all of the options and the costs, and most places will be able to spread the cost out, so it makes it a little bit more affordable there. But the most important thing is choose the right solution for you, and then worry about the cost afterwards. And it may be that the cheapest solution is the best solution for you. So I hope you found this really useful. If you've got any questions about dental implant treatment, then you can always ask me in the comments below, and if enough people are asking me, I might even make a video explaining certain points. Alright, I'll see you later. Have a great day.